standing kite. We have had one here. There are very many. You can see all over my legs.
You see, there are so many flies. So with the human hand alone, we cannot catch all these flies.
You see all this?
So what we've seen here is that just within the last 5 minutes since we've started this, we've been able to trap multiple Similium damnosum flies. So we can see that this is a hyperendemic region of onchocerciasis based on the human catching rate of the Similium damnosum. How many flies can you catch in one day if you were here? Can you give an estimate of the number of flies you
In a day, hundreds and hundreds.
You can see.
Wow, unbelievable.
Yeah.
Oh, there are so many.
You can see all over this. But what they do is they come to the skin. When they come to the skin to bite, in order to get blood, and if they have the younger stages of the worms will go into my skin, and when they are there under the skin, they multiply, they move all over the place, and the young ones end up the eye. That's when the eye problem comes.
Okay. So we are at Gonchogo village in northern Uganda. This is an hyperendemic area for onchocerciasis. We are here with some of the leaders of the village and the onco team. So we were going to do a little interview to find out a little bit more about the epidemic here.
Muse says there are a lot of black flies here. When it bites you and you scratch a lot, it can develop some wounds.
What are they doing for treatment?
Yeah.
They have been distributing Mectizan in this place some time back.
Okay.
Yeah, and that's the only intervention they have against onchocerciasis in this area.
She says there are a lot of flies, and when it bites, it itches a lot. And even around this time, sometimes when they come here, even trying to make chapats cannot make it. There are too many really.
In this community, which is nearby the breeding river, they have a lot of bites here. The mechanism they have devised when they are doing their homework or digging, like this woman here, they dress on long sleeves that cover up to the wrist here in order to avoid the bites.
Even when she's digging just at home, the fly is already here biting her at home. Even before she goes away from home.
Yes.
Yeah. You cannot manage to dig if you don't put on long sleeve sweater and gum boots, because if you, any body part that you leave free,
Open, yeah.
Yeah, in the open, the flies come and give
Bite,
a lot of bites. So mostly the ears and the head parts which are not covered are the ones that receive a lot of fly bites.
When they are bitten, they scratch, and the parts can easily get bruises. This is a kid who has been suffering from the bites. You can see all over the place, has been scratching, and now has developed some bruises. See these kids, this is a local community. They don't have enough clothes to dress up everywhere, so they suffer from the bites.
Hi, this is Ben. We're at the village on Goncho here in northern Uganda. We're about to do a health education on onchocerciasis. I'm here with the team. We're about to begin the formal health education of onchocerciasis at the community level.
The second one is which one? This one. It's what? The housefly. I was saying it even around here. So how do we get the disease? Someone who has the disease, the black fly comes, gets worms from this person, go to a person who don't have the disease and injects the worms in him.
So we're on the trail looking for, based on the model, the chlorophyll model, we're looking for the trailing vegetation along the turbid water sites. And we're going to begin the slash program. The team is here, as you can see, led by some of our Carter Center Foundation representatives. We're going to be looking for areas based on the model that we've created in the States of areas where we have prolific habitats, and then we're going to remove them. This is not an endeavor where we streamline and cut everything. We are targeted based on the model. So based on our GPS location, this is our first area. As you can see, there's turbid water. And we have a lot of hanging vegetation in this area. We're going to remove some of this vegetation in our intervention village to see if it'll affect the number of emergence of Similium damnosum here. So this is a typical submerged canopy port vegetation. This is an exact area of a vegetation that could hold a lot of larvae. We're going to remove this from our area so that we would know that the intervention is working based on the number of larvae emergence. You can see all the cover is being destroyed, all the debris is being removed from the site, all possible areas where larvae of Similium could occur are being destroyed by the boys.
This is exactly the slash that we are going to implement. When we do this, we are not cutting all these submerged vegetations throughout the river course, but we shall be targeting only the spots where there is rapid flow, because damnosum breeds only on the rapid flowing areas of the river.
So our challenge here today is to look at slash and clear implementation for Onco Similium damnosum elimination here at Apira village. We have done the narrow riverine areas. Now we're looking at a wide riverine area to see how effective the program would be in this particular location.
This is one of the potential breeding sites of Similium damnosum, and these are some of the activities that expose the local communities to the bites of the flies. They come to wash clothes. You see these young children here. They are bitten by the black flies. So what we are going to do is to slash and clear, and we see the impact.
One of the areas that we found with the chlorophyll model was this was one of our high prevalence locations. So based on the canopy gap locations, we have found using GPS coordinates multiple locations for prolific habitat. So now we're about to get some of the young men in the village. We're going to begin to remove some of the areas where we have larvae present. So this is one of our areas that we're cutting. Based on the model, we found that there's a lot of areas where larvae can attach to of Similium. The idea is to remove the areas where we have found a lot of the Similium. As you can see, you've got hanging vegetation. You've got a lot of areas here that need to be removed. The boys and I are removing all these areas because we know that these are high prevalence areas of the disease. One of the things that we want to accomplish here is to remove all the sparsely canopied areas where we know the larvae exist. So the boys and us, we're cutting feverishly in these areas because we know that this is an area of high prevalence. We are within about less than 1 kilometer of our villages. The boys are here from the village, so part of our program of Slash and Clear involves community participation. So besides just us coming here to remove, we're involving a lot of people here. We're involving with so the economy improves, obviously, and so we are really a task. As you can see, this is an enduring task of work, but we are privileged to do so.
There are so many of these kind of spots downstream as the river flows, and the river passes through several communities as it flows to the Nile. So wherever the river passes, in every community, we shall involve the community members in those areas to do the slash and clear in their areas so that we can reduce drastically on the breeding sites of S. damnosum. And with time, we have a very strong belief that we shall combat the sleeping river blindness in this area. These children here have accompanied their mother to the river. This is the same water that the mother fetches and takes home for cooking. It's the same water that they use for domestic chores, washing clothes. And when they want to wash clothes, they come to the riverside. And this is one of the most common activities that exposes the people to the fly bites. It's like fishing or washing by the riverside. So when these children are playing right here, as you will see, they've been scratching their body. They're experiencing a lot of fly bites in this area. As you can see on his body, there's a lot of scratching because there are a lot of fly bites in this area. And when they come to the river, they get exposed to the fly bites on the river. And this, as you can see, there are a lot of trailing vegetations. And our main purpose of coming to this place is to show that when we remove the trailing vegetations on the area, on the spots on the river where there is fast flowing, we shall reduce on the number of the breeding sites for Pseudomylium damnosum. And with time, when we roll out this program and involve the entire community, we have a very strong feeling that the fly biting rate is going to reduce.
Okay, we're here at a village. What is the name of this village, Dennis? I'm sorry.
Gwai village.
Gwai village. And we're here with a victim of onchocerciasis. This gentleman is blind. He's been blind for almost 10 years. We want to ask him a few questions. Let me ask you, has he suffered some nodules?
He has nodules on his body, and he has a lot of skin itching. As you can see, this is onchodermatitis. This is a typical nodule on him. There are several of them.
So we're working with the community, and the idea is that we localize areas where we have high prevalence so that we can prevent what's happening to this gentleman. So for example, my friend here, how long have you been in this village?
About 5 years.
5 years now. Eh? So what are you doing right now in terms of treatment? What are they doing in terms of treatment?
Once in a while, it's about 6 months, they drink this medicine.
Medicines,
Yes.
ivermectin,
Yes.
and things like that.
Yes.
We're about 1 kilometer from the river from where we were doing the slash and clear. The idea is to prevent this, obviously, especially among young children.
We are going to carry out slash and clear. Wherever the river passes, in every village, we shall recruit young men to do clearing of the fast flowing spots on the river.
One of the reasons we're here is to prevent blindness in children like this. This little child is innocent. She has done nothing. And in a world which is full of turbulence, such as malaria and HIV, we don't want her to go blind. That's one of the reasons we're here. Look at how wonderful and beautiful this world would be better without this fly. These are the kids of the village. As you can see, the facilities. We want to show how the Ugandan children are living in the remote villages. These are the areas that we're using for slash and clear, for helping, for the intervention. These are some of our local communities. So the idea for us is to stop these children from having a bad future. So once again, we are emphasizing our program Slash and Clear here in northern Uganda. This is the team, this is the boys that we've been working with together. It is a unified effort, and we are very proud of the work we've done here. These young men should be commended for working with us in Slash and Clear. We hope to continue this program here to reduce river blindness in these villages. Once again, we're very thankful to my colleague Dennis for working with the boys here, these young men who worked very hard for us, and we're very, very happy to work together in cooperation with the University of South Florida, Department of Global Health. So once again, thank you from here in northern Uganda.